Hi, good evening, guys. Welcome to this beautiful evening. Thank you for your time. It's quite late in Asia Pacific region. I believe many of you may have had dinner, or some may be going for dinner soon. But we really are very impressed with your dedication to attend the session today, and we promise it will be very enriching session. So as we know that technology is touching everybody's life in this world. We are always on our mobile devices, connected with the various apps and so on. So even the world of physiotherapy has not been spared. And as we look at the change in the trends, new development are overtaking our traditional way of practices. And one of them is these innovations of wearable technologies that are getting popular. And we will have a good overview today with Dr. Chris, who is going to take us through this journey. So the advantage of such technology is that we are able to capture a lot of data. We can do comparison of performance and session from one to another. We can store the data for the research work and so on. So as we get ready for the session today, let me quickly introduce you to Dr. Chris Proulx, who is actually a very accomplished professional with more than 25 years of clinical experience and also still practicing clinically, and is also the director of education with Digitsole. Uh, he has been speaker and presenter for several academic continuing education programs all over the world. And my first encounter to him was in probably more than 10 years ago. We
Yeah.
met each other at Heathrow Airport in one of the technology workshop that we were part of it, and was a amazing impression I had with him, and that carried for a decade over time now. So I'm very glad to be together with him today in this session and won't be there too long. There you go, Chris. Please carry on.
All right. Thank you, Dinesh. Yes, that was in 2005 or six, I
Yeah, yeah,
believe.
yeah,
So
yeah,
that
yeah.
that was quite some time ago. But
20, almost 20
yeah,
years.
so thank you for the wonderful introduction, and I think that's a great segue too, as you know, because you do this as well in terms of communicating with clinics and practitioners. The introduction of technology in our, as I refer to it, as conservative physical medicine. So if you're a physiotherapist, a chiropractor, a kinesiologist, even massage therapist, we tend to do things more on the low technology side when we do our evaluations. But today, we have some interesting opportunities for us, and in my opinion, I think it's going to change how we're going to be able to deliver healthcare, especially when we consider the money spent in healthcare globally. There's similarities in many of the same problems, and low back pain being one of them, as the largest global issue and the percentage of dollars spent in healthcare. So hopefully we'll see some changes. So today is sort of an introduction to that process. It's a little different than I usually do, but this was something that we presented on just a couple of weeks ago, and it had a really good response. And it also really does highlight the use of technology. I'm not saying that I'm focusing on any specific technology per se, but really focusing on walking. And I'll talk more about why that's been so important for me. So this is sort of a low level research project where I was asked to, evaluate the differences in footwear because I've been doing that for so long. But, how can we do some comparison? So what you'll see today or tonight, these are they're actually my shoes. So I was the quote unquote, guinea pig for this. And so let's get into it. I'm gonna share my screen, and hopefully we'll have well, it's sort of unilateral discussion, but know that there is a chat that you can type in some questions, and we'll be taking questions at the end because maybe we'll answer some of what would be questions during the process. So we always kind of wait to the end, especially in these events with such large groups. It's difficult to be highly interactive, but we will have some time for questions. And to echo with what Dinesh had said, really appreciate it. I know this is late in the Asia Pacific region, and so we do appreciate your time. And I love seeing these numbers because that shows that there is this dedication to wanting to hopefully provide some better care, better business, in clinical practice, which evolves around better care for the most part. And so we're going to look at the impact of these different footwear, and I'll talk a little bit about why we would even care about that. But before that, we want to thank Dinesh and his team, because this was a great job putting this together and getting the people out there, and we all work together. And I've, again, as was mentioned, I've known and followed Dinesh for a long time, and it's really important that we have these relationships between manufacturers and practitioners and salespeople. I've always said, I gave a talk to one of the groups internationally, and the sales individuals actually make the most amazing practice management consultants because they see all the differences and the changes, and they talk to so many groups. So thank you to your group. So the key points that we want to make is I want to really get into sort of the technology, but also why specifically looking at walking. So walking is my number one parameter that I measure in the clinic setting, which I've been doing for a little over 15 years. And it started because I used to run a lab, a biomechanics lab with lots of equipment, and I was in university as a professor and researcher at that time. And so it was always challenging to, have that many students and be able to give them the experience. So I was always reaching out to organizations, which is actually why Dinesh and I first met, in how we can team up and really create an optimal opportunity for learning and progressing within healthcare. So walking has a really unique aspect to it, which again we'll continue to get through, but it allows us for multi-systems integration evaluation of the overall health of an individual. But it's the commonality that we see, not in everyone, because there are some limitations in mobility, and obviously some changes with regards to lower extremity kinetic chain if there's an amputation or something like that. And then the focus that we're going to use as this example is going to be looking at its influence on different footwear. And can footwear be a problem, or could it also potentially be a solution? And that's sort of the way that I've been looking at it. Do we have a bunch of data that says that? I talk about running all the time, and when we look at predicting running injuries, we don't have a large consensus over what exactly we can do. And it's similar here, but we can at least evaluate and look at that progression. Again, a key thing that Dinesh had pointed out is that evolution in changes. And that's why I always put a quote in my talks. And so this is from a Dr. Jordan Peterson. And basically it's about, talking things. So I have a really unique position that I get paid to talk for a living and have a platform. So that's sort of the introduction. I'm just going to define Gait briefly and get into it really quick, but then look at some of the metrics that we can now collect that used to take potentially millions of dollars and a lot of time to be able to capture this data, which is why some people will still question, what is its usefulness? Why don't I see this? And it's because it's technology and it's new for a lot of people. And then specifically the use of this artificial intelligence in how we can use it to assess and provide the intervention aspect. And then, we'll get into a conclusion. So why walking? Well, it's something that we start early on. We use it as a method to evaluate things like gross motor skill patterns in children. In biomechanics, we joke you don't have to learn how to walk before you run, because they're very, very different, movement patterns. Although that's not really true, because it's part of the neurological and motor skill development evolution that we see. But also, it's something that we use to measure things like independence. It's a commonality that we find in so many people. It incorporates a multi-systems approach, right, from the cardiorespiratory system to the neuromusculoskeletal systems. And so it's a really good way to look at someone's overall health impact. And then many of us use it for implementing rehabilitation programs, right? And so that makes a whole lot of sense why it really is kind of this unique tool. But historically, we've looked at it more from a qualitative standpoint because we didn't really have that capacity to do so. Artificial intelligence in healthcare is growing very, very rapidly, much more quickly than some people might actually be comfortable with. But artificial intelligence really does similar to what we do as clinicians. In other words, you do an orthopedic exam, and then you may do a neurological exam, you take a history, and then you have to take that information, decipher it, and come up with certain conclusions, right? Your differential diagnosis, the first level, and then maybe a couple others that we call, zebras, for example, that they may not be, but it could be. But artificial intelligence actually allows us to very rapidly take that information and aggregate it much more quickly. And it's using certain algorithms that are developed through machine learning, but are also fed from real life world situations. And so it can make it easier to aggregate all the different data to provide us some of that information. For example, in imaging studies for breast cancer, just in the first year that it was really introduced into some of these systems, there was an 11% increase and improvement in the diagnosis of breast cancer. And as we all know, early diagnosis is really, really important in cancer. And it's actually no different. And I've written a couple papers on this topic. In fact, that early prediction in the musculoskeletal world, the conservative physical medicine space, also has the same effect in that it can help us to keep things from becoming more progressive. And even if we didn't care about that, it actually helps us to save money. So in the healthcare systems that are spending a lot of money on these conservative conditions. And I'd mentioned low back pain. So low back pain, globally, it even supersedes in certain third world countries, other types of conditions like hepatitis and HIV as the number one problem is low back pain. And so in the top 10, we typically see musculoskeletal, conservative, movement dysfunctional problems in the top 5. So why walking? Like I said, it incorporates a bunch of different components. It's the multi-systems integration. So there's a voluntary component to it where you have intent of moving from point A to point B. And there's also a lot of reflex components to it. So it addresses, 2 aspects within the neurological system. And of course, we're using the levers and the muscular components to be able to move and generate forces and react to forces and to go faster and to go slower and to change direction. And then there's a cardiorespiratory, which a lot of people don't necessarily think about. But for example, above the age of 60, if you're walking less than 2.4 miles per hour as a self-selected comfortable speed, that's actually been shown to increase the mortality by 10 years. And it's because of that connection to the overall health of the visceral systems, as more specifically cardiorespiratory. Decreases in walking patterns and speed and volume can also have an impact on Alzheimer's disease and other neurodegenerative conditions. So there's a lot of impact with regards to why we should test it, but also when we are testing it, even though we call it a performance-based outcome measure, right? How well someone is walking. With today's technology, we're able to look at all of those surrogate components, right? Surrogate meaning the breakdown, the parameters, the metrics, and those biomarkers. So gait is a timed execution, and that's that coordination pattern between the right and the left to make sure that we're shifting appropriately from side to side. We have the appropriate step and stride length. So a step is the distance of contact between alternating feet, whereas the stride we look at from heel strike to heel strike of that same foot. So the strike is typically something that we measure more often because it incorporates a little bit of that timed execution between that right and left side. The stance phase is broken down to about 60% of that gait cycle, whereas the swing phase is about 40%. In other words, you're spending 60% in that ground contact time, and then 40% of that same stride length is going to be in the air or through that swing phase. With walking, we have what's referred to as a double support phase. So there's a point in time where you have both feet in contact with the ground. In running, however, we have a flight phase where there is no double support phase. And in fact, you're actually going to be airborne for a certain percentage of the time. And those are important differentiators because we evaluate walking and running a little bit differently in terms of some of the characteristics, and we have more normative data for walking than we do for running. So a lot of reflex components to it, which again is very important because that also improves the overall efficiency, as well as incorporating what's going on in that neurological system. We have to deal with the effects due to gravity, right? Every time we take a step, we're going to raise our center of mass slightly. It's actually going to shift laterally slightly as well and medially. And so it's going to go back and forth. So that instantaneous position of center of mass is always changing just a little bit, but we're trying to maintain it in a relatively minimal position. And that takes a lot of effort, including reflexes. So we have to respond to every time we take a step in contact with that ground. And so think about these not only as things that we're dealing with as we're walking, but we can measure these sorts of things, and they actually have implication to what is going on with that person as they are walking. So as I said, the stance phase is about 60%. It changes, it fluctuates a little bit based on your speed as well as your cadence or how long your stride is going to be. But we can also further break down those phases within that phase, right? So there's going to be a first strike pattern, which is typically a heel strike in a walking, and then your toes are going to come down, then your heel is going to lift off, and then finally you're going to toe off into that propulsive phase, which is going to be the beginning of the initial of swing phase. And swing phase is about 40%. So not only is your leg going through the air, but it actually is following a very typical trajectory pattern that, again, we like to be able to measure. And then certainly as the foot comes in contact with the ground. A lot of people are familiar with, what is going on when we're trying to look at in ground contact, because that's where we are absorbing those forces. We are generating more ground reaction force to then move to that next position, which is going to be the swing phase again. And so those deliveries with regards to generating those forces have an influence on how our body is reacting and responding to those differences in forces. So let's look at the footwear. But before that, I bring this up because, and I have this quote in the last slide, which is, I was discussing Gait with a colleague, and he said, well, I don't care what someone does when they're wearing a shoe. I care what the foot is doing and the rest of the body when they're barefoot, because that technically shows us, how the body is necessarily responding to all of those forces and movement patterns that I just described. But the reality of it is, if people are walking around with shoes, then it should matter. And most of you are familiar with, the use of orthotics or inserts, because we use those to correct patterns. I think what's interesting is we typically used to, in a lab, measure people walking barefoot, and then we would make those corrections with the orthotics, not completely, but often sort of disregarding, what that shoe is also doing to the foot. So let's take a look at, some of these metrics and biomarkers that we should take into consideration. I'm going to show you a quick case just to illustrate some of the changes that occur very simply and acutely or instantaneously as a result of putting an insert in, and how it can impact what's going on in that particular shoe. So some of the major metrics and the most simpler ones, which we can also measure and follow its evolution, are speed, cadence, and stride. So the speed is how fast someone is moving. And we typically do this in three different ways. We can use an induced speed, such as being on a treadmill, so I can actually control that. And in some scenarios and situations, that might be more beneficial because I want to look at the impact of a specific speed on someone's gait metrics. We also have a self-selected speed. So the self-selected speed is when the person actually chooses how fast they can walk while feeling comfortable and having intent. And then we have what's referred to as fast pace. And the fast paced is we make them walk outside of what's normal for them when they're moving from one point to another one. And those things can impact a lot of these metrics. And so there could be some reasons why you may choose some. So cadence and stride. So if you have a longer stride, you can have a shorter cadence. If you have a longer stride, and the shorter that stride is, you can have a greater speed, even having that same stride length. So there's an interplay between speed, cadence, and stride. Symmetry is looking at the comparison between the right and the left with could be any metric. We often look at it in terms of stance phase or stance time, because that tells us how long they're spending in ground contact. And that has been shown to be very influential with certain conditions. And we'll get into that a little bit. Pronation and supination. So pronation and supination. Now, I didn't get into a lot of detail, but when we look at the biomechanics of gait, specifically at the foot, pronation and supination is, as most all of you know, a multiplanar or triplanar movement pattern that takes place at the forefoot. Are we actually measuring that in the shoe? Not directly, but we're able to sort of measure the result of that. And it will be a combination between pronation and supination and heel inversion and eversion. So many systems, even including motion capture, especially wearing a foot, will look at the foot more so as a block model, a rigid model, the foot really as a whole. Secondary markers or metrics, we can look at propulsion. So propulsion is a performance aspect of how someone is moving into that swing phase. And then certainly we can break down the other spatial temporal parameters with regards to what's going on during that walking cycle, such as the duration of the stride, the duration of the ground contact time, as well as the length, and certainly looking at the symmetry between the two. So I'm going to go through this quickly. I don't want to spend a lot of time on this because I want to show you what was fun for me to do. But so the reason I show this is because this is just to highlight that, the footwear can make a difference, and that we do influence, with orthotics, which I think is pretty obvious, but I think we need to make sure that we consider the footwear as we look at that. And actually, you might even consider that the footwear could be the corrective device that some people might use. There was a very interesting study done a few years ago, and actually there's two studies that are very, very similar, and they took patients with low back pain, and it's classified as non-specific chronic low back pain, which basically, as we all know, is we're not exactly sure what their cause is. And so they used gait analysis to evaluate these patients. And what they did was, instead of doing any specific exercises or other physical agents, all they did was find corrective ways to improve their gait pattern and to try and normalize it. So they had to figure out what their problem was, and then they would do something to normalize that. And what they found was a very significant improvement in overall, low back pain. In other words, that your gait could be your problem, and so there's a long history of taking that into consideration. So this was a 62-year-old male who actually presented with low back pain. Through evaluation, we did a full evaluation and including a walking pattern, but within this, we also identified that he had some chronic ankle instability issues. And he was a construction worker, relatively good shape, but he had just gone through a bout of COVID. And so we had him walk. I did have him on a treadmill, and I wanted him to walk at a comfortable speed, but the most comfortable speed we could get to was only about 2.0 miles per hour. And so what's that? About 4.3 kilometers per hour, and or about 4 kilometers per hour, which is relatively slow. So he wasn't comfortable walking faster than that because he didn't have confidence. He felt like he was potentially going to fall. So what we see here, and part of this artificial intelligence, is these systems can aggregate this information, base it against normative data. So as I mentioned earlier with walking, we actually do have normative data with walking, how fast someone should walk relative to their age, their gender, and their stature, their height, and as well as knowing what a stride length should look like related to that. So we see that he has a 96% symmetry, and that's in ground contact time. So that's actually a good thing, and that's why it shows up in green. We see he's only walking at 2.0 miles per hour, and that's in red because that's something that we would want to address. And then this amber color, this yellow, says that we're approaching what would be considered to be abnormal. So this is an easy dashboard. So that's where the artificial intelligence comes into play, and it makes it easier for me to say, oh, I don't want to waste a lot of time in things that are green, and I'm going to pay special attention to the red and a little bit of attention as I decipher through this information. We see that here's his walking profile here, and he has a 35-inch and a 32-inch. So that's actually really short. It's a very, very short stride length. And people that take short stride lengths is because of certain problems like weaknesses or confidence. They have a fear of falling. They don't want to move their center of mass too far outside of their base of support. And over here is this pronation and supination graph. In this green, we call this the corridor. And that's actually considered the normal position or trajectory of the foot as it moves through that stance phase. So this is ground contact, right? So the foot is in contact with the ground, and these are averages, and that's what the black dots are. And then the line is that average trajectory, the thick black line, and then the thin ones are the standard deviation. Now, we actually don't like to see this, as we see on this left side. If you can see my cursor there, we see on this left side, actually, let me do this. We see that in this region here, there really isn't any standard deviation. And so we actually want some degree of standard deviation, or covariance is another statistic that we use to look at that variation. If we look on this right side over here, right, this variation is actually quite normal. The reason for variation is it allows us to respond to changing environments, right? So even though he's on a treadmill at this particular moment in time, you should still see some variation, because we're not perfect. We're not exact every single time. So when somebody is, it means that they've worked really, really hard at that. So we see that this one is very much inside of that green corridor. And this position means that there's a lot of pronation and heel eversion. So even on contact, he's contacting on heel strike with a almost completely flat foot, whereas there should be some slight heel inversion and some supination on initial contact. And then when we put our toes down and go into foot flat position, that's where we reduce the supination and we go into a more neutral position. And the heel often will still stay, the calcaneus may still stay in a position of slight inversion approaching neutral, but we see that he actually goes into over neutral, especially on that heel off position. And remember, when we lift our heel off, we go back into supination in that forefoot because that transfers your weight to the first and second toe, right? And so he has to work really hard to do that, but he's at least trying that. He's getting, to that point in propulsion on that left foot, but he's struggling a lot here. And that's a problem. And the problem is because of excessive knee forces in particular. And so what could happen, if it hasn't happened already, is we start to see more of a knee moment of force in that valgus position, which we don't want to see, because in that valgus position, it puts more stress, especially as we reduce meniscus or joint space on the lateral aspect of the knee joint, which is eventually going to turn into osteoarthritis. So this is actually after. So we did a correction. And so what happened was, if you look over here on this left in that pronation and supination, we see that just that simple correction actually puts him in a much more advantageous position. It also corrects some of this, the variability. So he's not struggling anymore within that ground contact time in that foot flat position. Now, he has a motor technique that he's been using for so many years, so that's going to take him a little bit to respond to that. But overall, this acute change is very dramatic. And then let's also point out here, just that change, he's walking at the exact same speed. Let me go back so I can show you that. So 35 inches compared to 42 inches. That alone, just having that stability, improved his stride and allowed him to also improve his overall cadence. I kept him at the same speed so we would actually have some data that we could compare. This is referred to as the propulsion. So this is the ratio between the hip flexors and the plantar flexors. So he did have an advantage of plantar flexion on both feet. And then after the correction, which was in his left foot, we did see that he normalized there, and he's going to have some work to do. So keep in mind that a lot of these acute changes, like exercise, they're going to take place because the body works very, very hard to create symmetry, right? Even when there's a problem, which is why we don't like people to be in an antalgic position for extended periods of time. So again, this is just doing a comparison between the pre and the post of a very, very simple insert. So now let's look at some of these shoes. So these are actually in my collection of footwear. I call it a collection because I have a lot of footwear. I like footwear. These top ones, they are, I used to do some running, barefoot running, the Vibram 5-finger shoes. So there's no support in those shoes. And I started wearing these when I was coaching, doing performance coaching. So I'm on my toes a lot, and I'm either standing or running, and of course I'm on the ground. So there's really no structural support to these guys. The upper itself is a form of mesh nylon, and then the base, the sole of it, has no arch support whatsoever. And so it's really, it's called a low profile or neutral shoe. The Nike shoe is actually considered to be a walking shoe. And you can't really tell here, but there's a fair bit of a drop. So they have a higher heel on them, somewhat similar to what you might see in a running shoe. But as we'll see when we look at the base of these, they tend to be wider because the transition when you're walking versus running is a little bit different in that mid stance phase. And then this is the Under Armour Surge, which is actually a running shoe. And then this bottom one down here is a new shoe that's being released in, I think, about 7 more days. So I kind of had to block that one out. But this is actually considered to be a casual walker, which also has a very, very low profile to its arch support. Basically, it has no arch support in it, but we'll see the construction in the sole is a little bit different. So this is just looking at a top view, and then this is looking at the bottom view. And so one thing you'll notice is this running shoe here with the red. This guy is going to be the thinnest at that midpoint, which is going to be in that midfoot position, which makes sense. It's a running shoe. You do not need a lot of midfoot support in that because you transition very quickly if you're a heel striker to going into toe off. You don't spend nearly as much time in the ground. And we see this one all the way over to the right. This one actually has the widest base in that midfoot position. And then the next widest is actually going to be this middle, that Nike shoe, which is also considered to be a walker. So I performed this on a treadmill, and I kept the same speed. So that way, I could control that variable to look at some of these differences. So we look at the symmetry, the cadence, and the speed. So the speed looks normal. So I was walking at 2.7 miles per hour. Which is about 4.8 kilometers per hour or so. My cadence was normal in all of these. We do see some slight variations. So the increase means that I will have a shorter stride, most likely, and I have to take more steps, right? And that's what that means in steps per minute. We see that the symmetry is pretty consistent, although we do dip down a little bit here, and that's why this is showing this in amber. So if I look at this and it was all green, I probably wouldn't spend a lot of time because it would all be normal. But this amber one does make me think a little bit and say, okay, that's the first mark that says that shoe is a little bit different, and it's causing some asymmetry in that walking stance phase. I know these are small. I was trying to figure out the best way to show these, especially side by side. But this is the AI profile, the AI artificial intelligence walking profile. And the first one over here, this is stride duration. So the length of time that I'm in my stride measured in milliseconds. So we see 1,139, 1,115. What you really want to note is the AI system does a great job at showing me where I fall within the normative values. And then it tells me whether or not I'm not in those normative values. But even better, it tells me if I'm too high or too low. And so this shows me I'm right in the middle here. So that's actually what I want to see. The stride length, it's a little bit short. Now, keep in mind, I'm about 1.8 meters tall. And so walking at 2.7 miles per hour is a little bit slower than my normal pace. So I'm going to have a little bit shorter stride length, but that's fine because we're going to do a comparison. And what we see is I definitely have a longer stride on that left foot, a shorter stride on that right foot. And so this is on the lower end of approaching abnormal for that right. And the swing time is also similar. So I have a shorter stride length and I have a shorter swing time. And that would make sense because if I have a shorter swing time, if I'm moving at the same speed during that swing phase, I'm not going to cover as much ground. And that's a way to look at that. We see that the stance time, despite that, is pretty normal. Now, I have to let you know that I have a missing ligament in my cuboid. And so I have a cuboid syndrome issue on that left foot. And so that's usually the one I try and correct and protect for the most part. But then I also had a trauma-induced plantar fasciitis problem on that right foot that I'm still overcoming. So yes, I'm a bit of a wreck. And so footwear is real important to me. So then we see in this next shoe, so this is the Nike shoe, very similar in terms of the stride duration, similar representation here in stride length, as well as the swing time. But my swing time actually increased in both of these. So that probably means relative to my stance time, I'm going to have a little bit longer stride length. So we'll have to take a look at that. And just as a note, well, how could that be? Well, remember that these guys, this upper shoe here, this New Balance low profile, there's nothing. So it's all me, right? So there's no additional support, whereas this lower shoe right here is providing some of that recoil, that benefit. And so that could be why I have better propulsion on that foot, at least walking at this particular speed. Then we look at the running shoe here, right? Again, pretty consistent with regards to the stride duration. I wouldn't expect that to change too much. We see my stride length, it decreased a little bit compared to the other two. And then the swing time, again, I'm back to where I was in that initial. And my stance phase, again, looks pretty similar to these other ones. If we look at the last one, so this is this new shoe that has a very wide base. You can actually see the construction that the heel extends past where, the calcaneal will sit inside of that shoe bed. So let's see if that has much of an impact. We see that, well, basically very similar, but I'm in green for all of these metrics. And so that at least showed that was somewhat normal. So what does this actually mean? Well, if I had a shoe that was causing me to have a lower swing phase, if we look up at the very top here, so I'm in the amber zone with this guy. Now, if that was a patient or that was a person that you were worried about and they have some lower propulsion, and we'll look at that propulsion here in a moment, then you may want to take that into consideration, especially in your rehabilitation. If you're training them to be able to walk faster, that shoe may not be appropriate for them and can cause some limitation in their overall performance. But again, for me, using that for coaching, it wasn't considered a walking shoe. So then we've got the Gait line, and the Gait line shows us the center of pressure as we're going through that stance phase. And we see that they're all very, very similar. They're also symmetric. What you'll notice here is it shows a breakdown of the percentage. And so I'm in the upper here, and we see that they're all red. So I heel strike and I spend lower than the normal amount of time, and then I spend more time in that mid stance, and then my propulsion is also shorter on those guys. And so we see that consistently for all of those to some degree. And again, that's a foot issue. And then what's interesting is we compare that between the right and the left, and we see that there are some similarities. It's not quite as bad. And some of them, like in the walking shoes, the two walking shoes, and even the running shoe, show that propulsion is normal on that left foot. And I'll show you why that's important to me, because I overpronate on my left foot typically when I'm barefoot, and I oversupinate on that right foot because of that cuboid problem. So then we look at this propulsion. So the propulsion rate is looking at the comparison between the hip flexors and the plantar flexors. And so we see that we've got a normal ratio on that left. We do have some hip flexion advantage on the right. We seem to reverse that a little bit. These percentages are relatively low, so not something I'm overly concerned with, especially if that would be a normal walking speed. So if it's not, remember that it's kind of like looking at the effects of, some form of training. Um, we create the opposite in that walking shoe. We normalize it in that running shoe, which makes sense because those shoes are really designed for propulsion, right? To create the optimal um, foot position and propulsion to also benefit from the efficiency with regards to running and turning over that gait more quickly. Again, down here, we're good on that left side, the right side, a little bit more on the plantar flexors, which for people that are walking slower than normal, that's also really, really common. So that actually looks pretty good too. So here's looking at the trajectory in the foot in that stance phase. So remember, this green corridor was looking at that trajectory. And what this implies is supination, pronation. In other words, foot position with regards to ground contact, time, as well as force. The reason we care about this, right? So this one in this New Balance, so on that left side, that's actually that's a problem because if I wore these shoes as a walker, that may actually start to induce some knee problems because this position increases the knee valgus moment, which means that I'm putting a lot more stress on the lateral aspect of the tibial femoral joint. So if I don't have problems, it may lead to that. We don't know for sure because this is new ground for all of us. But if a patient came in with knee pain on that left side, or excuse me, on that right side, then I would definitely have to make some changes, as I showed you in that case in the beginning. We see that the standard deviations are also a little bit short, and we see the transition. So I heel strike relatively normal in these shoes, but man, I transition very, very quickly. As soon as I heel strike, I flop over into a very neutral position. I go from a heel inversion to a heel eversion and from supination to pronation very, very quickly. So that steepness is also something to take into consideration because that could be a motor control issue. It could be a structural issue with the shoe, right? We especially see that when people wear some walking shoes that have a very steep heel and they're not shaped appropriately, they flare out too much, especially if they're a heel striker. We look at the Nike shoe here, and that Nike shoe is a walking shoe. The only problem I see with this one is there's a lot of deviation into propulsion. And so what that means is it's very inconsistent and it may not be a problem. It could be just the result of not wearing that shoe for a while, and we may correct that. But I do see again some limitation in that standard deviation, but it's following a pretty good trajectory. And then we look down here over on the Under Armour shoe, the running shoe, and again, we're a little bit inside, but you know what? It makes sense because it's not designed as a walking shoe. So I know people, they like running shoes, they're very comfortable, but they don't actually make the best walking shoe, especially if there potentially is a problem, or if you actually measure them, you may see that there might be a future problem. So we see that it doesn't do a good job at correcting the overpronation and heel eversion effect that we see on this right side. And then this bottom one, that white shoe, which is another walking shoe, we see that it's at least following the same trajectory. It's a little thin in the variability here. Again, I don't know exactly what that will mean until we tested and did more work to find out if this even means anything. But more importantly, it's following the same trajectory. We're seeing a little bit better variability on this right side. I think what's interesting too is that has the widest flare on that heel, but yet it causes me to heel strike in a less heel inverted position for whatever reason. I'm actually okay with that because the transition into foot flat position is pretty normal. And I'm very well supported in that position. Um, and it looks like I'm following a very, very good trajectory. Now, the foot progression angle also has an impact on that knee moment effect. So this gives us the position of the foot in toeing out as I heel strike. So foot progression angle we see is equal on both of these. And you would think that it really shouldn't matter, regardless. And these are all pretty close in terms of the foot progression angle. So a normal foot progression angle should be somewhere between -2 and +14 degrees. And that's 2 standard deviations of normal Western population. It's a little bit different actually in Asian populations. They tend to be more toe out. So we do see that they're fairly normal, but we start to see on this Nike shoe that there's some asymmetry going on here for whatever reason. And it's causing a little bit more out toeing on this side compared to the very straight trajectory here. The other thing that we get is circumduction, how far that leg is swinging out. I wouldn't expect that to change much from shoe to shoe unless the shoe has an influence on that propulsion or toe off position, which we're going to look at here in a moment. So overall, these are fairly normal. Now, depending on the size of the toe box, the width of the toe box, that shoe construction in causing the transition from foot flat position into that toe off position is really going to influence this, as well as my speed and stride length. So we see here on toe off, I'm a little bit low. So we would want to see something closer to the 60 degrees. So 55 degrees is just 1 degree low. 56 degrees is actually going to be normal toe off. It's even lower on that right side. And then this is clearance. Clearance doesn't seem to be a problem in any one of these, but in this guy here, I'm not using a lot of toe off, which is certainly going to impact my my propulsion. So it could cause me to use more hip flexion, not getting the benefit of plantar flexion. Although, because I'm walking at a slightly slower speed, that may have that impact that we're actually using. We see here an increase in the Under Armour, the running shoe, in both of those, right? So it's doing its job as it's designed for running, but is it really necessary in walking? Up here in the upper right, this Nike shoe, we're at 55 and 50. So very similar to what we saw in that New Balance. We get some better correction here on that right foot, which is a good thing. And then that Ballaston shoe, very similar. We actually are approaching normalcy in that left foot. We're still a little bit low in that right foot, but again, that's okay because we're improving that pronation and supination aspect first and foremost. So we could actually look at, is there a benefit to making some changes as we, decide? So first off, we can see that footwear can impact your walking performance. And so if that matters, either maybe you're a walker and walking performance might matter, but look at it from the performance perspective of if it induces certain abnormalities, could it possibly also lead to some problems? When I was a younger man, before I went to college, I actually worked in a shoe store, and I got to see some of these older adults come in, especially women, that in history, footwear has an interesting trajectory, and it wasn't seemed female or ladylike to have big feet. So women would often try to fit their foot into a much smaller shoe, and that had a dramatic influence on the actual structural composition of the feet. I saw some very, very strange looking feet as a result of that. So footwear can definitely impact it. But we can also use footwear to potentially maximize that. And that's why if I have a colleague in California and he has a patient who buys 15 pairs of shoes at a time, tries them on, and they measure her performance and they get to send back the rest. So they actually measure and make sure that she uses the appropriate footwear. So choosing the appropriate footwear is certainly going to be an option. So I do have some patients that come in and we just test their footwear to see how well it's going to do for them. The other thing that we can do is sometimes I have patients come in and they just spent a lot of money on shoes. They're not going to take them back. It's too late. Maybe they've been wearing them for a while. Maybe they're a new patient. And so, well, we can actually correct their footwear with inserts and insoles, orthotics, and things like that to get the performance that's required to potentially minimize what might go on. We can also use specific footwear to correct an abnormal gait pattern. So in this situation I just showed you, as far as walking goes, if I was looking for the optimal shoe for walking, it's going to be between those two walking shoes, believe it or not. So the construction of the shoe does matter. And I used to see this a lot when I was working in fitness, people that would, buy these new shoes that really weren't running shoes or walking shoes, and potentially could lead to some problems. The other thing that we can do is we can follow the footwear pattern. So over time, so for example, I used to work with a lot of competitive runners, and we could tell when the wear pattern on the shoe was at a point where we actually needed to change that shoe out because it was going to impact their performance, or maybe it was going to lead to a problem. And then the use of technology. So we both, Dinesh and I, mentioned this, and this graph here it is. This graph here is actually looking at evolution. So I can chart, and this is a series of all those different shoes under some different scenarios, and I can chart, all of these patterns, and look at the evolution, especially during the rehabilitation process, or if I'm training, a runner, then that's another way to actually look at that dashboard of overall performance. So I know I cut it really, really tight. We do have a few minutes for some questions, but thank you again for listening. It's very late your time, and hopefully this was interesting for you.
Yeah, thank you, Dr. Chris. Absolutely, lot of information, lot of knowledge from your vast experience and your educational background, your PhD in exercise science. It's all put in together very, very beautifully. And guys, those who are online, quickly, I need you to help us out. We have got posted a poll right here. If possible, please just spend a minute and answer some of the questions in the poll. All you have to do is click onto the poll and reply. And Dr. Chris, there's some questions being posted. If you would, if you can actually access that, and if we can have time to, respond to that.
Yes, let me
Dan-
find
Daniel,
basically they're on the chat. Hello, everybody. They're on the chat.
So Daniel is posting question is, given shoes are designed symmetrical, then any asymmetry from different shoes is from the person to person. Is it not?
Yes and no. So right, so the shoe, absolutely, they're designed to be symmetrical, but we do not, acting like the heel boots that we might use for lower extremity problems that do not allow the foot to go through the normal mechanical aspect of that ground reaction force, right? The roller boots. Unlike a roller boot, the shoe design is constructed in such that it's supposed to address the different components of that stance phase. So what you saw was some shoes, actually, I was very asymmetrical, and some shoes I was very symmetrical, right? And so absolutely, that asymmetry is definitely on me, but it can either be corrected or worsened if I don't determine where my problem is. So for example, I didn't have a problem on heel strike for any of those shoes. What I did have a problem was in mid stance phase. And so some of those shoes didn't allow for the appropriate either support. But what's interesting, Daniel and everyone, is the shoe that had the second least amount of support was that white shoe, the walking shoe. There's no structural arch support in that shoe at all. It's completely flat in the shoe, similar to that top shoe, which was the New Balance. So even though they were similar in terms of their structural support in the arch, it was the base that was actually different, because the base in that New Balance shoe has very, very little structural support whatsoever. Basically, it would protect my foot if I stepped on a rock, but did not do from that. So you are correct in that It's a little bit of both, but what's interesting is the appropriate construction of the shoe can minimize those asymmetries associated with the individual. Dr. Ananda, could that be from tight gastroc? Yeah, so exactly. And again, it's not telling me exactly what the issue is, so I have to go a little bit further. And what we saw in the transition from that low profile shoe is bang, and then, slap down there very, very quickly. Could that be a tight gastroc? It could be. But in the other shoes, I didn't have that same problem, a very dramatic shift from heel strike into that foot flat position. So it's either could be that tight gastroc, or it could be as a result of the cantilever effect on some of those shoes that especially allow for better support, like we saw in the two walking shoes. The running shoe was a little bit in between those two, which again, if running's a little bit different, because then we look at, are they a heel striker or a midfoot striker? And I can correct that in a runner by just changing their strike pattern, which, well, it's not quite that easy, but it's an option. And then in fact, I'd actually be good with them having a little bit tighter gastroc, because that, aids to running economy. So that tension that we see in the lower extremity has been shown to have about an influence of about 30% to that running economy. So very well could be a combination of those things.
Yeah. Right. So
Daniel's got a follow up. Given that the deficiencies, go ahead.
No, I think, I guess we may be running out of time. So perhaps we can take some questions later if you can post. I think we'll be happy to. Yeah.
So I'll just finish this one, because this will be recorded.
Perfect.
So deficiencies, Daniel, you hit the nail on the head. There are studies of identical twins having different gait patterns because of their personalities and their attitudes. So very much physiological, biomechanical, as well as habitual. Keeps moving. And then to see some of these changes would certainly be very interesting. And that's the individuality. If you look at work by Inigo Muhaka on training some of the highest level, Ironman competitors, same thing. Identical twins don't even have the same taper as they're approaching performance. And so that's why I can't use the same shoe for everyone. But that's the benefit of evaluating that, and why some people will choose, other shoes. I've even found over the years, I've had to change my specific desire for certain shoes based on the changes that has happened as a result of me getting a little older and maybe a little heavier.
So those who may be wondering how Dr. Chris has been able to perform all this dynamic movement assessment is basically we are using this very flexible sensor-based insole that goes into the shoes, right? And is able to capture all the data. And this data is transmitted wirelessly to your remote devices like your mobile phone as well. So with technology's advancement, it is becoming extremely fast and efficient for us to capture all this data. Right?
Yeah. So it in my lab, we used to set up gait analysis. It would take between 1 and 3 hours, depending on what we wanted to accomplish. And now I can do an analysis in less than 3 minutes.
Yep. Yes, that's the beauty of it. Absolutely. Yeah. Sure. So I guess we are already shooting over the time, and we will be concluding the session soon. Those who have not completed poll yet, please give your feedback. Just 3-4 questions there to answer, and we look forward to you all in our next session soon again.
Yes, thank you. I look forward to seeing you all again. Bye-bye now. Take care.
Bye, guys.